Hello, I'm Dr. Jim Olson, reaching out to you from Seward Park. I'm looking across the lake at the place where we have the Run of Hope each year, and I have the fondest of memories of prior events and great longing for the future. People from all across the Pacific Northwest, the United States, and even around the world bring their kids to Seattle Children's for brain tumor care. And the reason for this is because of our reputation. Plain and simply, about 10 kids out of every 100 that wouldn't survive if they were treated elsewhere in the country will survive because they're treated here. That's right. Overall, over many years, our survival rates are about 10% higher than the rest of the country. Why is that? A big part of the reason is because we integrate research and clinical care. We had brain tumor paint available for patients years before it was available anywhere else. We developed a personalized genetic-based medicine for kids many years before insurance companies were paying for it. And in some cases, we were able to treat those kids with a pill a day instead of chemotherapy or radiation therapy because we understood the mutation that was causing their cancer and we could go after it in a targeted way. We have one of the best clinical trial programs in the country, and we've learned more about DIPGs and several other types of just menacing pediatric brain tumors than most places can, and it's because we integrate the clinical work, the research work, the laboratory resources of building models of all these tumors, and the caring work of our very attentive nurses, physicians, and clinical team. Why is this all possible? Well, a huge part of the reason is because of our patient families and their philanthropic work through their support networks, their families, and events like the Run of Hope. So it was patient families that funded the brain tumor paint when we were just getting it started and before we had funding from the National Cancer Institute. It was patient families through the Run of Hope that built over 50 models of pediatric brain tumors that are now used worldwide. It was the Run of Hope that supported genomic-based precision medicine years before insurance companies started paying for it. And all those clinical trials that we run, not enough money comes from the organizations that sponsor them, and all of the gap is coming from philanthropic sources like the Run of Hope. So if you're trying to think about whether or not you should donate to Run of Hope, reach out to your friends and family about Run of Hope, I ask you to just think about this. At Seattle Children's, 10 kids out of every 100 survive that wouldn't survive if they were treated elsewhere in the country because of our integrated research and clinical program. And Run of Hope is essential for driving the research component of that. So I encourage you to go big this year. Go bigger, as big as you can. Just go as big as you can and help make this a continuing reality of improved survival, better outcomes, one of the world's most robust programs, and an incredible community that we've built together. Thank you.